We're bringing a message of the importance of scaling innovations for those who need it the most. It's really about health equity, promoting impact in public health outcomes. And right now we're in a situation where there's actually a big paradox. We have so much innovation, there's really an abundance of innovation, new technologies, not least AI, and yet we have still over 5 billion people worldwide without access to health care.
So you think the biggest challenge is not a shortage of innovation, it's all about implementation? Absolutely.
Absolutely. And it's also about prioritization, right? So we want to move from what we've seen as a very supply-driven innovation ecosystem to one that's more public sector demand-driven. So really putting governments in the driver's seat in setting their national health missions and then rallying, convening, aligning their innovation ecosystems around that mission and having everyone play their part.
And you think government should take the lead and it shouldn't be really dictated only by the tech companies? And how do you strike a balance between public leadership and tech innovation in the private sector?
So we believe both are important, and one of the things we did was to create a systems innovation led by WHO, and it's called the WHO Digital Innovation Investment Platform. And that platform is really a mechanism for bridging the divide that we see between the public sector demand and the private sector supply of innovation and technologies, as well as the investor community that's also an important enabler of innovation scaling. So that platform will enable the meeting of the two and the engagement and the building of knowledge and evidence in this space and eventually co-creating pathways for scaling innovations in countries. It's not something that anyone can do, and governments have the mandate to serve their population health needs, and that's why we have developed recently this WHO Scaling Innovations in Public Health Systems Guidance and Toolkit, which really helps our close to 200 member states in having the right guidance, evidence-based, science-based guidance and tools to know how to do that.
Mm-hmm. And also here at VivaTech, everyone's talking about artificial intelligence. So how does the WHO advise on the adoption of the new technology?
So WHO's core role is to deliver norms and standards to help member states implement health in the most efficient and effective way. So that mandate to develop norms and standards is also something we apply, obviously, to the area of AI. I think AI is we can see it's happening. Right now, I think it's not really a matter of whether people have access to AI. It's more a matter of whether governments have the capability to govern and assess AI. Because what happens if you don't have that capacity, you become someone who inherits models developed elsewhere, and those models will be trained on data that may not be representative in your context. It will have hidden assumptions that may not be suitable and will not lead to the best health outcomes in your country. There can be hidden bias if the data is trained on a completely different type of population profile, etc. So there are examples of that, and that's obviously a reason for concern, this inheritance problem.